Community and Health Services Department. T. Paramedic and Senior Services Branch. Long-term care. Medical emergencies.
Urgency Plan Code Blue, Policy and Procedures, November 2022, page 1 of 8. Medical Emergencies Emergency Plan Code Blue, Policy and Procedures. Manual Emergency Management. Module 3. Policy number EM03.07, V.1.24. Applies to all long-term care staff, students, and volunteers. Effective date November 22, 2022, replaces December 18, 2018. Updates. To align with new legislative requirements and clarify responses to choking and unwitnessed cardiac arrests. Purpose. The policy provides guidelines for staff to respond and manage the following medical emergencies, in the home or on its grounds, to ensure the safety and security of residents, staff members, volunteers, and visitors in the homes. Unexpected cardiac or respiratory arrest. Any medical emergency that involves ABCs, airway, breathing, circulation, or loss of consciousness. Definitions. Cardiopulmonary resuscitation, CPR. The manual application of chest compressions and ventilations to a person in cardiac arrest, done to maintain viability until advanced help arrives. Code Blue, a term used to alert registered nursing staff of a cardiac arrest or medical emergency in an adult that requires their immediate response. Do not resuscitate, DNR. A medical order given by a resident or his/her substitute decision maker, SMD, not to attempt CPR if a respiratory or cardiac arrest occurs. Staff means a person who works at the home either A. as an employee of the region/home. This includes unionized staff, including but not limited to QP 905 long-term care bargaining unit staff, excluding seniors community program staff, and non-union staff working in the homes. This also includes any redeployed regional staff. B. has a contract or agreement with region/home. This includes but not limited to the medical director, registered dietitian, pharmacy service provider, physiotherapist, etc. Community and Health Services Department. Paramedic and Seniors Services Branch. Long-term care. Medical Emergencies Emergency Plan Code Blue, Policy and Procedures, November 2022, page 2 of 8. C. At the home due to a contract or agreement between the region/home and an employment agency or other third party. This includes agency staff, including those who may not provide direct care to residents. Note: education and training exemptions apply for those in B and C, who provide occasional maintenance and repair services to the home, and will not provide direct care to residents. These staff will receive information about emergency plans before commencing. Their services. Unwitnessed cardiac arrest. A cardiac arrest is called unwitnessed if the person is found without a pulse and no one was present at the time the person had the arrest. Note: any person in the home may witness an arrest, such as another resident, roommate, or visitor. Policy. The key requirements of this policy are: 1. A medical emergencies emergency plan, Code Blue, must be activated by any staff member, student, or volunteer for any resident or person experiencing a cardiac or respiratory arrest or other life-threatening medical emergency at the home. Note: excludes residents who have a do not resuscitate form and unwitnessed cardiac arrests that meet the criteria. 2. The homes will ensure the following access to medical services: that residents have access to medical services 24 hours a day. Defibrillators and response equipment are available at both homes. Registered nursing staff coverage is available 24 hours per day. All residents have timely access to all prescribed drugs. Three. All staff have a duty to support and respond to a code blue. 4. Equipment and supplies. The homes will ensure staff have access to resources, supplies, personal protective equipment, and equipment to adequately respond to a code blue. 5. Communications. The homes will be equipped with an effective public address system for announcing code blue to those in the home. 6. Reporting. The home must report a critical incident that presents an emergency to the Ministry of Long-Term Care immediately. Community
Note,
and Health
this
Services
includes reporting
Department.
immediately an unexpected or
Paramedic
sudden
and
death,
Seniors Services
including
Branch.
a death resulting from an accident
Long-term
or suicide.
care. Medical Emergencies Emergency Plan, Code Blue, Policy and Procedures, November 2022, page 3 of 8. Note, this includes reporting immediately an unexpected or sudden death, including a death resulting from an accident or suicide. 7. Education and training. All staff, students, and volunteers will be provided with education and training on the Medical Emergencies Emergency Plan, Code Blue, at orientation and annually thereafter. Seven. Education and training. All staff, students, and volunteers will be provided with education and training on the Medical Emergencies Emergency Plan, Code Blue, at orientation and annually thereafter. Note: for Code Blue testing and exercise requirements, see the Long-Term Care Emergency Preparedness and Response Training and Exercise Plan. Procedures. This section contains procedures for the following: A. Activating and responding to a Code Blue. B. During a Code Blue. C. Ending a Code Blue. D. Post-Code Blue procedures and documentation. A. Activating and responding to a Code Blue. 1. When to activate a Code Blue. Any staff member, student, or volunteer who finds a resident or person experiencing cardiac arrest, respiratory arrest, or an imminent life-threatening medical emergency, such as being unresponsive, must immediately notify registered nursing staff. Upon notification of the emergency, registered nursing staff will assess the person's ABC, airway, breathing, circulation, to determine and provide interventions and care accordingly. For LTC residents, resuscitation efforts, for example, CPR, will be started for all witnessed cardiac arrests, and a Code Blue activated unless the resident has signed a Do Not Resuscitate form. Note: staff should commence CPR only if there are resuscitation wishes, for example, no DNR. At each shift report, registered nursing staff will review resuscitation wishes with home area staff. All unwitnessed cardiac arrests will not be resuscitated if the resident meets one or more of the following criteria. O. The resident had a serious chronic health issue and is not a suitable candidate for CPR. O. The resident would not benefit from such a treatment. Community and Health Services Department Paramedic and Seniors Services Branch Long-Term Care. Medical Emergencies Emergency Plan, Code Blue, Policy and Procedures, November 2022, page 4 of 8. Oh, the treatment would be deemed futile or possibly detrimental, such as the resident being unresponsive for a period of time. Note: corrective action must be taken if the resident is choking. Corrective action for choking may include CPR, if needed, regardless of whether the resident has a do not resuscitate form in place, unless they have given explicit consent otherwise. See Advanced Care Planning Policy and Procedure. For non-residents, such as visitors, staff, etc., all cardiac arrests must be resuscitated, and a Code Blue activated note. The home does not maintain records of advanced care plans or do not resuscitate forms for non-residents too. Responding to a Code Blue, registered nursing staff will begin CPR and provide care accordingly until paramedics arrive. Delegate a staff member to announce the following statement 3 times over the public address system. Code Blue, home area, room number. All available registered staff on home area, please report. Delegate staff members to call 8 to 911 and state that someone is having a medical emergency. Provide the address of the home and follow their direction or retrieve, and bring the appropriate response equipment. See Appendix A, Medical Emergency, Code Blue, Response Kit, Checklist or Prepare Medication List, Transfer Sheet, and Advanced Care Plan, if one exists, for transport to hospital. Wait for paramedic services at the entrance and escort them to the Code Blue location. Note: defibrillators are located on the wall opposite to the elevators at both homes. The charge nurse or designate will go to the location of the Code Blue and assume command of the emergency, as well as assist with CPR if required. Note: the number of staff attending the Code Blue should be limited to the minimum staff required to safely respond to the situation. Community and Health Services Department. Paramedic and Seniors Services Branch. Long-term care. Medical Emergencies Emergency Plan, Code Blue, Policy and Procedures, November 2022, page 5 of 8. B. During a Code Blue. Available registered nursing staff and physicians in the home area will report to the location and assist with CPR and other duties as required. Non-registered staff members will keep residents calm and away from the Code Blue area, continue with regular duties unless otherwise assigned, and clear a pathway for paramedics. The charge nurse or designate will determine how many staff may enter the location where the medical emergency is occurring, and what equipment or supplies need to be passed into the room where the emergency is occurring. Request additional support if required, and announce the following statement 3 times over the public address system. Code Blue stat. Home area, room number. All available registered staff, please report. Outbreak considerations. Registered staff responding from another home area will wait outside the home area in the event they are required to replace another responder whose personal protective equipment, PPE, has been breached. If needed to replace another responder, follow appropriate infection, prevention and control, IPAC, precautions, including practicing proper hand hygiene. Replacing any PPE in the corridor outside the home area experiencing an emergency before entering. Donning enhanced PPE when a Code Blue is on a home area in surveillance or outbreak, or for a resident on additional precautions. C. Ending a Code Blue. The charge nurse or designate will declare the Code Blue over. At the direction of paramedic services. The person is pronounced dead. See Registered Nurse Pronouncement of Death Policy and Procedures and Managing Resident Death Policy and Procedures, or the person regains consciousness. Community and Health Services Department. Paramedic and Seniors Services Branch. Long-term care. Medical Emergencies Emergency Plan, Code Blue, Policy and Procedures, November 2022, page 6 of 8. Delegate a staff member to announce the following statement 3 times over the public address system. Code Blue. All clear. Note: once a Code Blue has been declared over, normal operations resume. D. Post-Code Blue procedures and documentation. The charge nurse or designate will report any incidents involving visitors and other members of the public using the Bodily Injury Reporting Form, InSurge. Upon notification of incident/injury of employees, request that the employee's supervisor follow the employee incident injury process. See Incident and Concern Reporting. Upon notification of incident/injury of students, volunteers, agency staff, and contracted service providers, notify the supervisor of that individual about the need to complete the non-regional incident reporting form, InSurge. Designate nursing staff to 1. Notify the resident's SDM, if applicable, the resident's most responsible physician, medical director, director of care, DOC, or designate regarding the Code Blue incident. 2. Document the Code Blue incident in Point-Click Care, PCC. 3. Ensure all emergency response equipment is replenished and cleaned after each Code Blue ends. See Appendix A, Medical Emergency, Code Blue, Response Kit Checklist. Conduct debriefs and other actions as required by the Long-Term Care Emergency Recovery Plan. The Director of Care, or designate, will follow the mandatory and critical incident reporting policy and procedures. Follow the Managing Resident Death Policy and procedures. Notify Joint Health and Safety Committee regarding all incidents involving staff, volunteers, visitors, and contract workers. Notify the Education and Wellbeing Team to ensure staff supports are in place for those who experience distress. See Appendix D, Suggested Support Resources in Emergency Recovery Plan, Policy and Procedures. A supervisor of any employee involved in the incident, and who sustains an injury or a near miss, will Community and Health Services Department, Paramedic and Seniors Services Branch, Long-Term Care, Medical Emergencies Emergency Plan, Code Blue, Policy and Procedures, November 2022, page 7 of 8. Follow the Employee Incident Injury Process. All incidents must be reported through the online e-incident report form on the Parklane system. Note: all incidents, including near misses, must be investigated by employers. See Incident and Concern Reporting. A supervisor of a student, volunteer, agency staff, or contracted service providers involved in the incident, and who sustains an injury or a near miss, will complete the non-regional incident reporting form. Roles and responsibilities. Role responsibilities. All staff, students, and volunteers immediately notify registered nursing staff of any medical emergency. Must support a Code Blue. All registered staff must respond to a Code Blue. Registered nursing staff must maintain annual certification in CPR and provide copies to Education and Wellbeing Team. Attending physician, respond to Code Blue. Review assessment, intervention, and implement treatment related to responding to a Code Blue, as required. Director of Care, or designate. Initiate mandatory critical incident system, if required. Charge nurse, or designate. Assume command of a Code Blue, until the paramedics arrive on site. Ensure completion of Appendix A monthly, and after every Code Blue. Emergency and Contingency Planning Specialist. Provide education and training on emergency plans. Complete After Action Review, AAR, as required by the Long-Term Care Emergency Recovery Plan. Education and Wellbeing Team. Offer registered nursing staff on-site CPR training. Ensure staff supports are in place for those who experience distress. See Appendix D. Suggested. Community and Health Services Department. Paramedic and Seniors Services Branch. Long-term care. Medical emergency. Support resources in Emergency Recovery Plan. Policy and procedures. Maintain staff records of education and training. Authority Fixing Long-Term Care Act, 2021 S.16, 82, 28 and 90. General Regulation 246-22 S.85, 86, 115, 263, 22, 268, 270, 271, 1F, and 273. CARF Aging Services Standards, and York Region Seniors Services Administration. Related resources. Appendix A, Medical Emergency, Code Blue, Response Kit. Checklist. Related Home Policies, Emergency Planning Policies and Procedures, Mandatory and Critical Incident Reporting Policy and Procedures, Orientation and Training Program Policies and Procedures, Palliative Care Policy and Procedures, Managing Resident Death Policy and Procedures, Advanced Care Planning Policy and Procedures, and Substitute Decision Maker Fact Sheet. Do Not Resuscitate Form. LTC Emergency Preparedness Manual. Approvals Manager, Policy, Planning and Communications, Directors of Care, Medical Director, Legal Services, Administrators, and Director, Seniors Services. Policy Contact Senior Program Analyst Review Period annually.